So Sherry's lying on her stomach with feet off the edge of the bed, and I stabilize the lower leg, and I'm doing an eversion movement here. There's not a lot of eversion in this ankle, but there is some. And then I'm going to twist the heel medially so the foot, the calcaneus, rotates outward. Some of that movement is happening in the ankle, but most of it is subtalar. And this has a distinctly different feel. Do you feel a difference?
Yes.
And how about when I twist this way?
Yes.
And that's the limit. That's as far as I can make it go. And that movement is called abduction, as opposed to this one. It's just a block. So hopefully the camera angle can capture that. That results in some stiffness in the midfoot when we try and pronate the midfoot. She's tighter on the right side. Since you're laying on your stomach, we'll keep you there. And I'll demonstrate the difference in hip mobility. So the left hip extends very freely. The right hip does not. The right hip lacks extension. When I spring the left hemipelvis, the whole body moves. On the right side, I can't get that movement to go beyond the pelvis. There's a lack of movement. Let's have you lie on your back, please. When I take up the slack on the left and then spring it, there's a movement and a recoil. On the right side, I can't take up the slack. It's stuck. It's not moving. And if I double that force, there's still no give. So we named that an anterior ilium. It's not the most appropriate nomenclature, but we won't debate that here. The pubic joint, here's belly button. So I just indent soft tissue here, come down to the waist, and then we land. Right there is the top of the pubic bone. And my left finger is lower towards your toes. Okay? Now you could be laying with the pelvis tilted. If that was the case, if it was just positional of the pelvis, then there would not be a step off when I walk across the left pubic bone onto the right pubic bone. But in fact, there is a step down. Do you feel that?
Yes.
Describe it.
It hurts.
Okay, and?
It's very tender.
Okay. Can you tell it's a step down?
When you point it out, yes.
Okay. Alrighty. So, it's interesting that you've had rehab after your hip surgeries, correct?
Yes.
It's interesting that you still lack hip extension on the right hip. I'm surprised by that. But I can't really capture on the camera the restriction up high in your neck, so I won't show that on the camera. But today we'll work on the subtalar joint and the midfoot. We'll restore your hip extension, and we'll get that right pubic bone, we'll glide it back up. It takes about 5 minutes. And then we'll treat this anterior ilium. But most importantly, we're going to teach you how to keep those movements. So it's not a model of care where you come back and then I do this thing to you each time you come.
Right.
You come once, and I do that to you. And then you come back in a couple of days, and I get to see how your body integrated that work. And on the second visit, I teach you how to take care of it yourself. So it's a really lousy business model, and I'm a fool. I'm a perfect fool. And on that note, I'm going to stop filming.